My name is Deepak Sharma. I'm from Delhi, and this is regarding my mother's case, who is a chronic liver patient infected with hepatitis C and suffering with this chronic liver disease for more than last 10 years. And there were a lot of symptoms like frequent blood vomiting and fluid accumulation in the stomach, which was leading to a lot of severe abdominal pain and congestion, breathlessness, fever, and this everything was leading to very frequent hospitalization for a kind of temporary treatment in the form of blood transfusion and tapping of fluid from the abdominal cavities. So this was going on, and after a while the stage came when the doctor started suggesting about certain surgical procedures, and it started with some kind of shunting to take out the fluid from the lung area and let it go to some other area. I mean, it's quite technical, which I don't understand, but yes, there was this surgical intervention which was advised, and later on after that they said that liver transplantation also suggested, and it was a very shocking experience for us to decide about the transplantation part of it. And this is, I mean, all in all, there were, in fact, before surgical interventions, the doctors also advised to do not advised, but they started the antiviral treatment, though it was very expensive. But since the patient is there and needs some treatment, so we have to manage it. So we try to manage it, but then the antiviral treatment also had its own side effects, and we could not continue it in spite of having decided to afford it. Same way as the liver transplantation surgical procedure, though we were all set prepared to go for it, in spite of it being very costly, very expensive, but still there were a lot of complications. There was a lot of the risk to the patient. There was a risk associated with the donor side and the availability of the donor, and even the post transplantation there was no guarantee that patient will be all right. So all these circumstances forced us to look for some solution somewhere, and we started talking about it, and at that stage our family physician suggested Dr. Subhash Chandra's name. Dr. Subhash Chandra is based in Hyderabad. We approached him, and we went there with our mother, and she was investigated by him. He has his own method of doing it, and post that he started the medication. And it has been 3 years now, and symptomatically there have been great changes. I mean, there are no more blood vomiting as such. There's no blood loss in the blood vomiting. Even the fluid accumulation in the stomach has also almost kind of disappeared, and we don't have to go to the hospital for all those things for which we were going earlier, like the blood loss or the fluid accumulation or congestion, breathlessness, pain, fever. So and this is a lot of saving for us in terms of the time which earlier we were spending going to the hospital. We don't go for the hospital now. The money and the efforts, and of course the most important part is the peace of mind, and we are able to have a more comfortable life with her now, and she is pretty fit now. She is active. She goes around, does her stuff on her own, and we can say that she is she has kind of given new life with this treatment from Dr. Subhash Chandra. And in my opinion, I would like to advise, or rather suggest all those patients who have this kind of problem, and they should consult him, take his advice, follow the treatment, and I'm sure they will also be benefited. That's it. Thank you very much. यहाँ से अंदर की तरफ चले जाओ।